Hello and welcome to my channel. Today we'll continue our talk about the pelvis. So let's begin. Last time we studied the individual bones, and this time we will articulate the bones. We study the joints in the pelvis. The first one is the lumbosacral joints. It's between the bodies of S1 superior surface and the lower surface of L5 border. This is in the middle. And at the peripheries, posterolateral is the articulation between the articular processes, the zygapophyseal joints. Now, between the body with an intervertebral disc, fibrocartilaginous disc, remember the components of the disc we talked about, the nucleus pulposus and annulus fibrosus. Here in this region, in the disc between L5 and S1, it's thicker anterior than posterior because the sacrum is angulated to the back, making an angle with the L5 vertebra. You know what I mean? So it's thicker anterior the disc than posterior. Now, if this is of the symphysis type, cartilaginous joint of the symphysis type, the zygapophyseal joints are the plain synovial type. And the ligaments that fix these joints, the lumbosacral joints, are the iliolumbar ligament. As you can see here, it comes out of the transverse process of L5 going to the iliac crest. See the iliolumbar ligament, and the lumbosacral ligament, also from the transverse process of L5 to the sacrum. You can see that. So the lumbosacral ligament and the iliolumbar ligaments are the ligaments for the lumbosacral joints. Remember this, please. Okay, you can also count the sacrotuberous and sacrospinous ligaments as ligaments of the joint, which is distant from them, but they share in the stability of the lumbosacral joint, and as well as, of course, the sacroiliac joint, which plays a major role. This is a distant relation, so only the ligaments of the lumbosacral ligaments are the iliolumbar and the lumbosacral ligaments. Now, the sacroiliac joints, on the other hand, remember the L-shaped facet we find on the lateral surface of the ala of the sacrum, and at the same time posteromedial on the iliac bone of the hip bone. Remember this, with an area for the articulation with a rough area posterior-superior to it for the attachment of ligaments that support the joint. Actually, the between articular facets is the sacroiliac joint, and the surfaces are interlocked so to resist movement between the two bones, and it allows only for small gliding movement, and this occurs only in labor in women. That's why the ligaments controlling or fixing this joint is under the control of hormonal control. Okay, they ossify with age, and in men before women because of the effects of the hormones, and the females gets in females the joint gets obliterated after menopause. It solidifies, turns ossifies. Okay, but before that it allows only for a slight gliding movement in the sacroiliac joints. The ligaments, you expect ventral sacroiliac ligaments, see, ventral at the ventral aspect, and a dorsal sacroiliac ligaments connecting the crest, the two lateral crests, the medial and lateral crest, to the iliac bone and the sacrotuberous ligament, so connecting the sacrum to the iliac bone. And in between the dorsal sacroiliac ligament and the ventral sacroiliac ligament, the gap between the bones, the gap between the ilium and sacrum, the rough areas on the ilium and the sacrum, is filled up with a very tough ligament, one of the strongest in the body. It's posterior-superior to the L-shaped articular surface for the sacroiliac joint, and it fills the gap between the two bones. It's a very tough and strong ligament. It's called the interosseous sacroiliac ligament. So we have the ventral sacroiliac ligaments, the dorsal sacroiliac ligaments that cover the posterior surface of the interosseous, which is in a middle region between the dorsal and ventral. It's called the interosseous sacroiliac ligament. Okay, remember these as ligaments for the sacroiliac joint. These are tough ligaments because the sacroiliac joint, it transmits the weight, half weight of the body to the lower limb on each side. That's why it needs strong ligaments. The sacrotuberous ligament is considered a ligament, belongs to the joint. See, it comes from the lateral part of the sacrum and goes to the ischial tuberosity, and midway it turns into a thick band in the middle rather than being a band at the peripheries, the sacrotuberous ligament. The sacrotuberous ligament forms part of the inferior aperture of the pelvis, or the pelvic outlet. See, it's part of the pelvic outlet that we studied, beginning from the coccyx through the sacrotuberous ligament, the sacrum, ischiopubic ramus, and inferior pubic ligament, and going to the other side. This is the aperture, or the pelvic outlet. This ligament is perforated by perforating cutaneous nerve, by branches from inferior gluteal artery, and filaments from the coccygeal plexus. All these pierce the ligament, and in the real specimen you will see the structures passing through the ligament. There's another ligament. It's a sacrospinous ligament between the sacrum and the base of the spine, the ischial spine. As you can see here, this is the sacrospinous ligament. Now, MCQs about this part of the pelvis, the ligaments, the sacrotuberous and sacrospinous. The sacrospinous is ventral to sacrotuberous. So the sacrospinous is part of the lateral pelvic wall and not the sacrotuberous. But the sacrotuberous forms part of the aperture, the inferior aperture, which is the pelvic outlet. This is how you answer questions about these ligaments. Who's ventral, who's dorsal, who's part of the pelvic lateral wall, and who's part of the pelvic outlet. This is to remember about the sacrotuberous and sacrospinous ligaments. Both ligaments, because of this, their attachments, they turn the greater sciatic foramen and lesser sciatic foramen into greater and lesser sciatic foramina. Sorry, it was notches before and then turned into foramina, because they complete the closure of the notches, the greater, all the lesser sciatic notches. Okay, the greater sciatic foramen, the one you can see here, which was a notch before the ligament, the sacrotuberous and sacrospinous ligament, structures passing through it is extremely important to know for your exams. The main structure is the piriformis, and they distribute other structures according to their relation to the piriformis. Now, the piriformis passes on its way to the greater trochanter of the femur. Now, above it is the superior gluteal nerve and vessels. Anything else is below it, like the pudendal nerve, internal pudendal vessels, nerve to obturator internus, nerve to quadratus femoris, and the posterior femoral cutaneous nerve. They all pass beneath the greater sciatic foramen, but beneath the piriformis. Now, the sciatic nerve itself, if it came in one piece, it's the sciatic nerve in nature is two cords joined together by a neural sheath, by connective tissue wrapping. Same like electric cable. It's composed of the common peroneal and the tibial nerves. If you don't mention sciatic, you mention only common peroneal and tibial, that's okay, because in many cases they come out separately. And in cases that it comes out separately, the common peroneal nerve usually, I say usually, pierces the piriformis, comes through the piriformis. So if you saw a specimen with the piriformis pierced by a nerve, that's the common peroneal nerve of the component of the sciatic nerve, and you'll find the tibial nerve coming out below the piriformis and then joins the common peroneal nerve lower down to form the sciatic nerve. These are the structures passing through the greater sciatic foramen. Now, the lesser sciatic foramen, the internal pudendal vessels and pudendal nerve came out of the greater sciatic foramen. They will go into the lesser sciatic foramen. So they bypass the levator ani muscle, the one we will talk about, the pelvic diaphragm. Okay? And the obturator internus with its nerve, the nerve to obturator internus that supplies it, but also pass through the lesser sciatic foramen. Okay, so these are the contents and structures passing. It's extremely important to know them by heart for exams, and multiple questions come on this area of the pelvis. Now, the sacrococcygeal joint is a symphysis type. There's a fibrocartilaginous disc, remnant, and a remnant of hyaline cartilage. The ligaments for the sacrococcygeal joint is ventral ligament, which is X-shaped, as you can see here. The ventral sacrococcygeal ligament, the dorsal sacrococcygeal ligament, the one you see here, and the lateral sacrococcygeal ligament. It's a ligamentum band here, should be here, joining the lateral border of the coccyx to the sacrotuberous and sacrospinous ligaments. And when this ossifies in X-rays of old people, you'll find 5 sacral foramina instead of 4 on each side. This is because actually maybe ossified in one side and not the other. So this makes what's so-called the 5th sacral foramen. It's not a foramen in the bone, it's between the bone and its lateral sacrococcygeal ligament. Pay attention to this in X-rays. It's a normal finding in X-rays of old people. The intercoccygeal joints between the vertebral pieces of the coccyx, the 4 pieces, are of the cartilaginous symphysis type, and the ligaments are the same we mentioned here, the ventral and dorsal sacrococcygeal. Now we are lift up with this symphysis pubis, the one you see here. It's the 2 medial surfaces of the pubic bones, then a layer of hyaline cartilage of each, then a piece of fibrocartilage in the middle. I was asked about the arrangement of layers in the USMLE exam. Bone, hyaline cartilage, fibrocartilage, hyaline cartilage, bone. So it's a cartilaginous joint of the symphysis type. It has ligaments also. It has a superior suprapubic ligament and an inferior or subpubic ligament, this ligament, subpubic ligament. Between its edge and the perineal membrane passes the deep dorsal vein of penis, or the clitoris. Okay, between the membrane here and the subpubic ligament passes the deep dorsal vein of penis. It's essential for erection. So this is the symphysis pubis, the last joint in the pelvis. Now we're left up with the obturator membrane. It doesn't belong to any joint, but it fills the gap, obliterates the gap, obturates the gap. It's in interlacing fibers, and there's a canal high upward formed by a gap in the membrane for the obturator vessels and nerves to pass. Obturator vessels and nerves to pass from inside to the outside. It gives attachment to obturator internus muscle, obturator externus muscle, and the pubofemoral ligament of the hip joint. We will study this in detail with the hip joint of the lower limb. So this is about the obturator membrane. The last topic we'll talk about in this lecture is the difference between men and women's pelvises. Now, the target is to maintain or to make sure that there is enough passage with no impedings to the baby. So this means a major difference in the characters in the female. It needs to be wider. So actually the lateral masses of the sacra enlarge more. See the ratio here between the body of the sacrum and the distance between the ali of the sacrum. It's a third or less. It's less than a third here. So because the ala are enlarged, look at this here in this pelvis. The ratio is more than the third. See that? More than the third of the distance between the two sacroiliac joints, because the ala here did not enlarge, because this is a male pelvis. Other features is the, for example, the ischial spines. They do not protrude inside the pelvic cavity as much as they do in the male pelvis. Okay, because also we don't want to make an impedance to the pathway for the baby to be born. Actually, the bispinous diameter is the narrowest diameter on the outlet. It's narrower in males than in females. Also, look at this angle, the subpubic angle. See that? See the difference between the two pelvises? This is about 50 to 60 degrees. This is about 80 to 85 degrees angle to make sure that the pelvis is more widened than the males. And also look at the pelvic brim. It's almost circular in female, but it's heart-shaped in males because the promontory protrudes inside the pelvic cavity in a longer distance than it does in females. So actually you will find everything that makes sure that the passage of a born baby will not be impeded, will be a normal passage. Okay, women who has different ratios and narrower ratios than this, called they have contracted pelvis, and contracted pelvis is one of the indications of cesarean sections. You can assess this by digital vaginal examination, and we will talk about this when discussing the pelvis as a whole, the diameters of the inlet and the diameters of the outlet. So now you have a good picture about the articulations in the hip, in the pelvic basin. I hope you got the maximum benefit from this lecture, and thank you very much for watching.